Welcome back. In this video, I'll teach you everything that you need to know about the first-degree heart block, which exam makers love to ask about. It's simply caused by something causing a small obstruction that is very minute, but it does affect the heart. The obstruction is the electrical pathway from the atria to the ventricles. As we know, the electrical current normally starts in the right atrium and it descends into the heart. This pattern goes down a specific pathway in a specific arrangement of cells. Now it can be severed completely, but it can also be obstructed just mildly. And in cases of mild obstruction, we'll have first-degree heart block. This mild disturbance of the electrical pattern is quickly corrected by the ventricles. So the atria will contract, but the ventricles will have some problems contracting immediately, but they will eventually figure it out and contract, which is why we see a small increase in the distance in the PR interval. Normally we have the P wave and immediately we have the QRS complex. And this indicates a functioning heart where the atria contracted and followed by the ventricles. But in cases of small delays, the atria will contract, the ventricles will take some time, but they will contract eventually. And this is what we see in first-degree heart block. The main cause is some AV node disturbances, mainly fibrosis and rarely myocardial infarction. But it can also be caused by vagal tones, which can be the result of emotional disturbances, inflammatory conditions, electrolyte imbalances, which is a very important cause, post-cardiac surgery, which isn't a big deal after cardiac surgery, and in many patients it's simply idiopathic. Most patients of first-degree heart block don't have any symptoms at all, but they can have some vague chest and abdominal symptoms. Think of dizziness, some chest tightness or chest pain. Some of them might have palpitation, some vague abdominal pain or discomfort, and shortness of breath or lightheadedness. To treat the first-degree heart block, we simply have to treat whatever cause that we know that can cause the first-degree heart block. So if the patient has some inflammatory condition, we should treat those. If they are taking certain medications that have this risk, we should stop them, and so on. So it's a mild condition and it's very common in exams, but it's easily treated and the symptoms aren't very severe. Our ECG course contains all the changes that can occur in an ECG, and it helps you become an ECG expert, so that you can recognize any ECG that you might come across. The course contains everything that might affect an ECG, all the symptoms, the causes, and of course the treatments. It also has plenty of quizzes to test your knowledge and make sure that you cement these informations and be able to answer any question about an ECG. You can access the course using the link in the description or in the pinned comment.